We're on chapter 6, part 3 of The Brain Saver by medical medium Anthony Williams. We're going to finish off this chapter tonight. We left off on vagus nerve healing. To heal vagus nerve problems of any kind, you want to address the different possibilities of why you're experiencing that symptom or condition by, now it's in bullet points. Okay. Reducing and eliminating your exposures to toxic heavy metals, air fresheners, fragrances, scented candles, colognes, perfumes, scented deodorants, fabric softeners, MSG, and other brain betrayers you'll learn more about in part 3. Lowering viral infection with support from part 5 of this book, Bringing Back Your Brain. Going on a supplement protocol for your symptom or condition from this book's companion, Brain Saver Protocols, Cleanses, and Recipes. If you don't find a supplement protocol for your specific symptom or condition, use the cranial nerve inflammation and or vagus nerve problems supplements list. And knowing how to restore the nerves themselves. Let's fill in that last piece, how to restore our nerves. It's critical to know how the vagus nerves work and how they can feed themselves to get stronger or even heal. What do the vagus nerves need for nutrients, and how best can the vagus nerves receive these nutrients? The vagus nerves are made up of nerve cells. Nerve cells are the hungriest cells of all when it comes to sugar. Nerve cells demand glucose. I'm gonna highlight that or underline it. That's interesting. The vagus nerves are made up of nerve cells. Nerve cells are the hungriest cells of all when it comes to sugar. Nerve cells demand glucose. When you're trying to heal a vagus nerve condition, it's critical that you don't have insulin resistance. Removing or lowering fat-based foods in the diet is a way to eliminate insulin resistance so that the glucose from critical clean carbohydrates can enter into the nerve cells easily without a lot of fight. Every single nutrient, every vitamin, mineral, trace mineral, electrolyte, amino acid, phytochemical compound, antiviral and antibacterial compound, antioxidant, and anthocyanin can only enter into a nerve cell if it's attached to glucose. Nerve cells open up to be fed as glucose arrives. So that nutrient being attached to glucose is the only way a nerve cell can receive nutrients. I gotta just underline that piece too. It's the only way someone can receive, for example, vitamin B12. If it arrives with glucose. If someone is on a high-fat diet, which causes insulin resistance, this means that glucose cannot easily enter into nerve cells. Meanwhile, practitioners and doctors are taught to demonize glucose-rich foods, such as fruits and potatoes, creating a fear of nightshades and too much sugar. And fruit. Due to this lack of knowledge, medical communities unintentionally hold back a person's healing opportunity. As a result of not enough bioavailable glucose in the diet and too much fat, whatever vitamin B12 and other nutrients that person is consuming are going to have much more difficult time entering into nerve cells for restoration. For a chronically ill person, this matters greatly. There is no time to waste in the healing process. I get that all the time since I'm currently in school. I always bring a buttload of fruit and I always have a juice, usually 2. I have my lemon water, my celery juice, my apple juice, cucumber juice, orange juice, grape juice, whatever, right? And I'll usually bring 2 bananas, 2 oranges, and an apple or something like that. All my classes are 4 hours long. And I've gotten asked a lot of times or told you're eating too much fruit, isn't that a lot of sugar? or like comments about that. And honestly, it's kind of exhausting to like give a whole detailed explanation. So I'm usually just like, not for my body. It might be too much sugar for you, but it ain't for me. You know, like I just keep it simple. What you need to know about vagus nerve exercises. Because publicly known medical research and science don't have answers about why millions of people in the world are ailing from symptoms and conditions such as anxiety, depression, chronic pain, loss of motor skills, brain fog, confusion, and many other symptoms, this has resulted in a search for answers outside of publicly known medical research and science offer. In other words, it has resulted in creative ways to distract people in hopes that these distractions can be remedies. This is how vagus nerve hacks and techniques become a trend. While some techniques can be helpful as temporary measures for some people, the techniques are instigative and irritating on the nerves for most people. Medical medium information throughout the decades has made the connection between anxiety and the vagus nerves, and this has struck a chord in the health world. That information has stated that inflammation of the vagus nerves can bring about many symptoms that are involved in anxiety. As this information has been passed on from individual to individual, details that matter were left out. For example, the details that viral neurotoxins, toxic heavy metals, and brain betrayer chemicals are what inflame the vagus nerves and bring about anxiety symptoms such as tightness in the chest, unexplained pressure on the throat, difficulty breathing even when the lungs are in good shape, unexplained nausea, anxiety, even the feeling that your stomach is flipping, and tingles and numbness running down the arms, shoulders, and abdomen. As someone runs off with the medical medium concept that the vagus nerves are connected to anxiety, the important details about how the vagus nerves become and stay inflamed fall to the wayside. As a result, we feel like we have to fix the vagus nerve with physical exercise. The most common of the self-help trends are breathing techniques and exercises along with particular body movements intended to support the vagus nerves with the intention of fixing someone's anxiety. This is a noble intention. When we can't find answers, we don't want to just sit around not having any kind of direction at all. These techniques keep many people occupied and proactive in trying to get some relief. What about the person who's never had to do a vagus nerve exercise? They're 80 years old, they've never had debilitating anxiety or other symptoms related to the vagus nerve, and they never had to do any special vagus nerve exercises to keep it that way. They haven't escaped health issues altogether. Maybe they have osteoporosis, they had their gallbladder out 20 years ago, they've had cancer and survived it, and they've had back surgery, and yet they've never had vagus nerve symptoms. The truth is that they didn't suffer anxiety and other neurological symptoms because they didn't have viral inflammation of the vagus nerves, or toxic heavy metals inside certain areas of the brain, or what people so commonly experience, the combination of the right blend of toxic heavy metals inside the right area of the brain, plus viral inflamed nerves such as the vagus nerve. Temporary quick fix remedies such as exercises and movements in hopes of altering someone's anxiety by shifting, tightening, or toning the vagus nerves is not getting to the root problem. The cause of why someone is struggling with anxiety or other symptoms and conditions that medical medium information connects to the vagus nerves. I'm not opposed to creative ways to shift someone's being or attempt to gently shift inflamed vagus nerves in hopes this will alter anxiety. Yet we have to be cautious. Most people who involve themselves with these practices end up worsening their condition because they injure their vagus nerves by poking or trying to manipulate the nerves when they're already dealing with vagus nerve inflammation for other reasons, such as shingles, EBV, or herpes simplex viruses. Their nerves have already become hypersensitive. Gentle exercises aimed to calm or ease anxiety that have a label saying they're for the vagus nerves are unpredictable. Some people will get away with it, and some people will not. We have to remember to err on the side of caution and be careful with any vagus nerve exercises. Many people are really struggling with brain inflammation, brain stem inflammation, and cranial nerve inflammation, all due to viruses and or toxic heavy metals or other brain betrayers such as pesticides, insecticides, and fungicides, and their nerves don't bounce back easily after they've been played with or manipulated in any way, even when using a technique that may be okay for someone who only has very mild anxiety and doesn't have a lot of inflammation yet. The next time you come across a trendy post or video saying that vagus nerve exercises are the answer, remember that you read here. Remember what you read here. It's worth repeating. Vagus nerve issues can be hypersensitive. They're touchy areas. You need to handle the vagus nerve grapevine with finesse. Treat it right, give it what it needs, and get rid of what's causing it to ail. Many people who are sick with chronic symptoms and conditions due to brain inflammation or cranial nerve inflammation don't have room for mishaps. Their reserves are low. Their nerves are chronically inflamed for real reasons, and their anxiety is impeding their life for real reasons. The not so sick, those people who haven't had their lives upended by symptoms yet, can play around with exercises in hopes that it keeps a little anxiety at bay, and you can call these vagus nerve exercises if you want. For the sick, those people who have to shape their lives around their symptoms, there's no room to play around. It's in these cases that many of these approaches either don't work at all, even temporarily, or they outright worsen the situation. When the vagus nerves are inflamed, either at the brainstem or along the nerves themselves, there's a good chance we may injure or inflame areas more easily when engaging in exercises and hacks. There's a lack of understanding and knowledge about the vagus nerves because medical research and science don't have information on why our vagus nerves get inflamed, nor do they even realize we're living with inflammation of the vagus and or other cranial nerves, and that can get us into trouble. A sensitive vagus nerve that is inflamed from viral neurotoxins can worsen when we experiment with ways to stimulate or move it. For your well-being, it's best to learn how nerves such as the vagus, trigeminal, and facial nerves become inflamed, to address them at the core of their inflammation, to heal from the inside out, and to be cautious about trying temporary patches that are applied from the outside in. The goal is to address the real cause of the vagus nerve issues, the real cause of the inflammation, with the resources in this book and Brain Saver protocols, cleanses, and recipes. All right, we have finished chapter 6.